Welcome to Next General Guides. If you're a student and need help in studying for exams, you're in the right place. So, you're gearing up for the IC&RC Alcohol and Drug Counselor exam, and reading the material isn't enough. I will help you prepare with 20 practice questions that have been designed to mimic the style and cover key domains you may encounter on the ADC exam. We'll go through each question. I'll give you a moment to think, and then we'll break down the correct answer and explain why it's the correct answer. So, grab a notebook, get comfortable, and let's dive into these questions. Number 1. When a client presents with both a substance use disorder and a co-occurring mental health condition, such as depression or anxiety, this is referred to as what? Here are your answer choices. A. Comorbidity. B. Dual diagnosis. C. Both A and B. D. Differential diagnosis. The correct answer is C. Both A and B. The terms dual diagnosis and comorbidity are often used interchangeably in the substance abuse field to describe the presence of two or more disorders in the same individual. Understanding this is crucial because effective treatment requires an integrated approach that addresses both the substance use and the mental health condition simultaneously. Number 2. A counselor administers the DASC-10 to a new client. What is the primary purpose of this specific tool? Is it A. to assess the severity of alcohol dependence, B. to screen for problematic drug use, C. to diagnose specific personality disorders, or D. to measure a client's motivation for change? The correct answer is B. to screen for problematic drug use. The DASC-10 stands for the Drug Abuse Screening Test, 10-item version. It's a brief, straightforward tool designed as a first-pass screening to identify individuals who may have a problem with drug use and could benefit from a more in-depth assessment. It's not a diagnostic tool. It doesn't tell you what disorder someone has, but it flags the potential presence of a problem. This is a critical distinction. Remember, screening comes before assessment. You screen to see if there's smoke, and then you assess to find the fire. The DASC-10 is one of the most common screening instruments you'll encounter, so it's essential to know its specific function is to screen for drug use, not alcohol. That would be a tool like the audit, and not to provide a full diagnosis or measure motivation. It's the first step in the information gathering process. Number 3. During an initial screening, a client reports drinking a few beers after work daily, mentions occasional memory loss, and notes that their spouse has expressed concern. What should be the counselor's immediate next step? Should they A. immediately recommend a 12-step program, B. develop a treatment plan based on this information, C. conclude the client is in denial, or D. conduct a comprehensive biopsychosocial assessment? The correct answer is D. Conduct a comprehensive biopsychosocial assessment. The information gathered in the initial screening raises several red flags: daily use, memory loss, and interpersonal conflict. These are strong indicators that a more thorough investigation is warranted. A comprehensive assessment is the only way to gather the necessary detail across biological, psychological, and social domains to understand the full scope of the client's situation. It's the foundation upon which any effective treatment plan is built. Jumping to conclusions or recommendations would be premature and unprofessional. Here's question 4. In the context of motivational interviewing, which of the following best demonstrates the principle of express empathy? Is it option A, you need to stop drinking if you want to keep your job? Option B, I understand why you feel that way. It sounds like you're in a tough spot. Option C, let's list the pros and cons of your substance use. Or option D, many people have overcome this, and you can too. The correct answer is option B, I understand why you feel that way. It sounds like you're in a tough spot. This statement is a classic example of reflective listening and the expression of empathy. It really shows that the counselor is listening, trying to understand the client's perspective without judgment, and validating their feelings. This is the absolute cornerstone of motivational interviewing. It builds rapport and creates a safe space for the client to explore their own ambivalence about change. Question 5. During the initial sessions with a client who is mandated to treatment and expresses anger and mistrust, what is the counselor's primary goal? Is it option A, to complete the intake paperwork as quickly as possible? Option B, to convince the client of the benefits of sobriety? Option C, to establish a therapeutic alliance based on trust and rapport? Or option D, to confront the client's resistance directly? The correct answer is, without a doubt, option C, to establish a therapeutic alliance based on trust and rapport. With any client, but especially one who is mandated and resistant, nothing productive can happen until a foundation of trust is built. The therapeutic alliance is the single best predictor of treatment outcomes. This means showing unconditional positive regard, expressing empathy, being genuine, and creating a safe, non-judgmental environment. This has to be the top priority, above all else. Number 6. A client consistently misses appointments, argues with the counselor's suggestions, and minimizes the impact of their substance use. From a motivational interviewing perspective, how should this behavior be viewed? Is it option A, as a sign the client is not ready for treatment and should be discharged? Option B, as a personality flaw indicative of an antisocial trait? Option C, as a signal of dissonance in the therapeutic relationship? Or option D, as proof that the client is a lost cause? The correct answer here is option C, as a signal of dissonance in the therapeutic relationship. The contemporary, MI-informed view of resistance is that it's not a trait of the client, but rather a sign that something is off between the client and the counselor. It's interpersonal feedback. It might mean the counselor is pushing too hard, moving too fast, or not understanding the client's perspective. It's a signal for the counselor to change their approach, not to blame the client. Number 7. Win treatment planning. Identifying a client's sober social network, job skills, and stable housing would fall under which category? Is it A, client liabilities, B, recovery barriers, C, relapse triggers, or D, recovery capital? The correct answer is D, recovery capital. This is a key concept in modern addiction treatment. Recovery capital refers to the sum of all internal and external resources that a person can draw upon to initiate and sustain recovery. This includes social capital, like supportive family, friends, and community, human capital, such as skills, education, and health, physical capital, like housing and money, and cultural capital, meaning values and beliefs that support recovery. It's really everything a person has going for them. Understanding and building a client's recovery capital is a proactive, strengths-based approach that is central to effective, long-term treatment planning. Question 8. When gathering a detailed history of a client's substance use, which of the following is the least important piece of information for the initial assessment? Is it A, the age of first use, B, the specific brand of alcohol the client prefers, C, the pattern and frequency of use, or D, previous treatment attempts and their outcomes? The correct answer is B, the specific brand of alcohol the client prefers. While this detail might come up in conversation, it has very little diagnostic or treatment planning value compared to the other options. It doesn't tell you about the severity, chronicity, or nature of the dependence in the way that the other pieces of information do. It's a superficial detail in the grand scheme of a comprehensive assessment. Question 9. A client says, I know my drinking is causing problems with my family, and I probably should cut back, but I'm not sure I'm ready to quit completely. I enjoy it too much. According to the trans-theoretical model, or stages of change, which stage is this client in? Is it A, pre-contemplation, B, contemplation, C, preparation, or D, action? The correct answer is B, contemplation. This statement is the textbook definition of the contemplation stage. The client is aware that a problem exists and is seriously thinking about overcoming it, but they have not yet made a commitment to take action. This is the stage of profound ambivalence, where the client is weighing the pros and cons of change. They can see the good and the bad in their substance use, and they feel stuck in the middle. Question 10. After a thorough assessment, a counselor determines that a client has a severe substance use disorder, a history of withdrawal seizures, and no stable housing or social support. Based on ASAM criteria, what would be the most appropriate level of care to recommend? A. Outpatient program, also known as ASAM Level 1. B. Intensive Outpatient Program, or IOP, which is ASAM Level 2.1. C. Medically Monitored Inpatient Residential, that's ASAM Level 3.7. D. Peer-led support groups only. The correct answer is C. Medically Monitored Inpatient Residential, or ASAM Level 3.7. This is really a question about matching client needs to the right intensity of services, which is the whole purpose of placement criteria like ASAM. The key factors here are the severity of the substance use disorder, the high risk for withdrawal, especially with a history of seizures, and the lack of a safe and supportive recovery environment, meaning no housing or support system. All of these factors together indicate that the client needs 24-hour medical monitoring and a structured therapeutic environment to be safe. Question 11. During an initial interview, which of the following questions is most likely to elicit the richest, most detailed information from a client? Is it A. Do you drink every day? B. How much do you drink on an average day? C. Tell me about what a typical day looks like for you. Or D. Has your drinking caused you any problems? The correct answer is C. Tell me about what a typical day looks like for you. This is a classic example of a broad, open-ended question. It doesn't just ask about substance use, it invites the client to describe their life in a narrative format. Within that story, the counselor can learn about routines, relationships, stressors, social activities, and how substance use fits into the bigger picture of their life. It really opens the door for a much deeper understanding. The other questions are closed-ended or a bit more restrictive. Question 12. What is the most effective way for a counselor to encourage a client to be honest about the extent of their substance use, especially when shame and fear of judgment are present? Is it A. By adopting a stern, authoritative tone to show the seriousness of the situation? B. By sharing personal stories of their own past substance use? C. By using a non-judgmental, empathetic, and collaborative approach? D. By threatening negative consequences, such as reporting to a probation officer? The correct answer is C. By using a non-judgmental, empathetic, and collaborative approach. This really gets to the very heart of the therapeutic environment. Clients are much more likely to be honest when they feel safe, respected, and understood, not judged. Creating an atmosphere of unconditional positive regard, where the client feels like the counselor is an ally working with them, is honestly the most powerful way to break down the walls of shame and fear. Honesty is actually a byproduct of trust. Question 13. So, imagine this: a client's family calls the counselor, and they're deeply concerned about the client's ongoing substance use, but the client themselves kind of minimizes the issue. The client has actually signed a release of information for the family. So, what is the counselor's best course of action? Is it A. Agree with the family and confront the client with their concerns? B. Tell the family they can't discuss the client and end the call? C. Listen to the family's concerns and then, in the next session, explore the client's perspective on the family's worries? Or D. Arrange a family session immediately to resolve the conflict? The correct answer here is C. Listen to the family's concerns, then in the next session, explore the client's perspective on the family's worries. This approach really respects everyone involved. Since a release is signed, the counselor can listen to the family. But the primary therapeutic alliance is still with the client. The information from the family is valuable collateral data, but it should definitely be used therapeutically. The best way to do this is to bring it into the client's session in a neutral, exploratory way, like saying, "Your family reached out and they're worried about you. Can you tell me more about what you think they're seeing?" Number 14. Which of the following is considered a strong protective factor against relapse? Options are A. A history of multiple previous treatment episodes. B. A high-paying but high-stress job. C. A strong, positive social support system and well-developed coping skills. Or D. A belief that willpower alone is enough to stay sober. The correct answer is C. A strong, positive social support system and well-developed coping skills. These are two of the most robust and consistently identified protective factors in recovery literature. A supportive network provides encouragement, accountability, and practical help, while effective coping skills give the individual the tools to manage stress, cravings, and difficult emotions without resorting to substance use. Question 15. Before beginning the assessment process, a counselor must obtain the client's informed consent. What does informed consent primarily entail? Is it A. Getting the client's signature on all the necessary forms? B. Ensuring the client understands the nature of treatment, its risks and benefits, confidentiality limits, and their rights? C. Informing the client of the counselor's personal opinions on addiction? Or D. Having the client agree to follow all treatment recommendations without question? The correct answer is B. Ensuring the client understands the nature of treatment, its risks and benefits, confidentiality limits, and their rights. Informed consent is not just a signature, it's a process. It's the counselor's ethical and legal obligation to make sure the client is making a truly informed decision to participate in services. This means clearly explaining, in language the client can understand, what treatment will involve, what the potential good and bad outcomes are, who their information might be shared with and why, like the limits of confidentiality, and their right to refuse or withdraw from treatment at any time. How did you do on this practice test? Let us know in the comments below. If you found this helpful, please like this video, subscribe to Next General Guides for more AI-powered study materials, and hit the notification bell so you don't miss our next video. Keep studying smart, and we'll see you next time.